12th MAPICON to deliver talk on this lasers. Laser is well known for kidney stones and prostate, and now the horizon is widening. We use it for bladder cancer also and many other conditions. You know, if you see a person, 60-year male with BPH symptoms or 40-year male with multiple stones, and you want only one technology, and that is a laser. You can, treat all the conditions. And everyone knows what is laser. It is a light amplification by stimulated emission of radiation. It absorbs the energy in one form and then delivers the energy, light energy, which can be used for various purposes. So I will not go too much detail into this physics and all that, but let's see what are the advantages. It is very precise and accurate, less invasive. Patient can go home the same day. Pain is less, bleeding is less. So wherever there are very vascular prostates, a lot of bleeding, the laser helps us. Or there are many comorbidity conditions, like Dr. Kaler is sitting, he say this is a cardiac patient taking a lot of anticoagulants, you don't operate upon that patient. So we can do laser surgery for these kind of patients. Hospitalization, operating time, that is short. Most of the procedure can be done on outpatient basis. So these are the advantages which has brought laser into practice of urology, and even into some transplant patient also we have used laser. I will show you. So for BPH, for stones, even for bladder neck contracture, we can give incision. Endopilotomy, where there is a UPJ obstruction. Optical internal ureterotomy, like stricture urethra. Infundibulotomy, and now the recently en-bloc resection of bladder tumor. This is a very good trend, and which I will show you a small video on this, because this is the latest addition in urology. Bladder tumor, all of you know, arises from the bladder mucosa. As it grows inside the lumen, pointer hai? So as it grows inside, it can invade. No, I want this. No, I want that. Anyway, so it grows inside. So when you are resecting the bladder tumor with traditional procedure, you have to remove the mucosa and then the deep biopsy to include the muscle, so that we want to see whether this is a muscle invasive or it is a superficial limited to mucosa only. This with laser, we remove the bladder tumor en bloc, taking the mucosa and not moving. Oh, it is not moving. So you have removed the whole of the bladder tumor en bloc, including the mucosa and the muscle, so the histopathologist can tell you whether it is limited to mucosa only or it is deeply in muscle invasive tumor, and then you can plan the treatment. We have started first time in Punjab, and lot of newspaper gave us the coverage. Then laser is well established for the treatment of kidney stones. Kidney stones can be of various types. It is not a simple one stone is equal in all the patients. They can be very hard stones, which are very difficult to break with the current pneumatic lithotripsy or ultrasonic lithotripsy. They can be very soft. They can be of different compositions like uric acid stone, calcium oxalate, phosphate, which are harder stone. Then there are different struvite stones and cystine stone, which are fluffy kind of thing, cotton kind of thing, which cannot be broken with the contemporary treatment modalities, energy modality. Then their location varies, whether they are inside the kidney calyces or they are in the ureter or they are in the bladder. Laser is one versatile, energy source which can be passed through the flexible ureteroscope. Flexible ureteroscope can be passed anywhere in the kidney, and with that help, we can remove the stones from anywhere. So this is the versatility of the lasers. So as all of you know, what stone cause, what kind of pain they cause. They can cause pain, fever, blockage of the kidney, and many other things. And simply we can detect the stones with the examination of the urine and the X-ray abdomen. which can be then corroborated whether the kidney is damaged or not with the help of intravenous urography. All these involve the contrast in anything. If the person is pregnant or person is having kidney failure or other things, then this kind of modality cannot be used. And now the non-contrast CT scan of the kidney, ureter and bladder tell you everything about the urinary system, and you can see stone whether it is in the kidney or whether it is in the ureter or they are in the bladder or even the stone stuck up in the urethra. Yesterday I got a patient suddenly having a retention of urine. We saw on ultrasound there is a stone in the urethra. We just passed ureteroscope, laced it, and the patient went home passing the urine. So this is the versatility of the laser. They can be used for stones anywhere in the system, and the patient can be made stone-free. Stone-free rate with the laser treatment is the highest compared to any other energy source system. This is the, again, advantage. This not really make you understand. This will become too hypothetical, you know, if I keep on speaking from here. So anyway, stone can be in the ureter, which can be, you know, rigid ureteroscope can be passed up, which is called contemporary ureteroscopy, URS, and the laser can be passed through it and stone can be removed. When the stone is in the calyces, you know, the system is bent like this, then you need to use the flexible ureteroscope. No energy system can pass through flexible ureteroscope except the laser. Then the size of the laser also matters. The contemporary laser, they were very thick. They were more than 300 micrometers. But now we have got the latest advanced laser system, most powerful system. Okay. No, it is coming? Yeah. So, if the stone is lying in the calyces, none of your rigid contemporary instrument can go up to that. So we have flexible ureteroscope. Again, advancements keep on coming in the flexible ureteroscopes. Then we have the laser fiber, which can also bend like this. And it can lay the stones lying anywhere in the kidney, and you can make the patient stone free. So, if the stone is in the ureter, URS, if stone is in the kidney, retrograde intrarenal surgery, which is RIRS. These days, patient will come, they don't know what is stone, where is the stone. Doctor Sahab, RIRS karoge? What do you know about RIRS? Patient come and they command, tell us, Doctor Sahab, I want only RIRS, I don't want any other procedure. So he is heard from somewhere and he just wants this procedure only. Okay, it depends where is your stone, what is the composition of your stone, how hard it is, and what it is blocking, and what instrument we will use. That depends on us. Leave that, if you have faith in us, leave that decision to us. And so RIRS has become very common otherwise, because this makes the kidney free of stones, stones lying anywhere. With one, you know, instrument, you can go to any part of the kidney. Earlier, we used to do percutaneous nephrostomy and then PCNL, removing the stones. I will show that diagrams also, from puncturing the kidney from the back side. But if there were multiple stones lying in the multiple calyces, we need to do multiple punctures. With this procedure, RAS, you can avoid all those kinds of punctures and remove the stones. But then limitation is size. If the stones are too big, you cannot remove all the stones by RIRS. Now the patient will come, he'll say, no, I want RIRS only. For that, we have now another advancement. I'll come back to you with that. So this was contemporary extracorporeal shockwave lithotripsy, which has now faded. Very few patients need this kind of thing, and this is a very expensive machine, and now not many hospitals are having it. These are the bigger stones in the kidney, which can be removed with PCNL, as I told you, by puncturing the back of the patient like this, what we are doing. But stones cannot come out like that. You have punctured the kidney and you stone. You have to use some energy source to break the stone and then remove the stone. As I told you, for breaking the stone, the laser is the most powerful energy system. It is not that the patient will say, Doctor, laser kar do ji. So you will see कि laser कित्थे होदी ज़्यादा फायदेमंद है, कित्थे हो नहीं है, कित्थे हो तोड़ेगा भी कि नहीं, पहुंचेगा भी कि नहीं पहला. So contemporary nephroscope used to be used in 30 French sheath. Now we have mini PCNL and then micro PCNL. where the smallest instruments are passed into the kidney with very small puncture. There the laser is very, very useful because the size of the laser fiber is in microns. There you cannot use contemporary energy systems like ultrasonic or pneumatic lithotripsy because their size is bigger. You need then bigger scope and bigger puncture. And then now we are doing with mini PCN. Now this is again taken over by next procedure, as I told you, RARS. This is a flexible scope which can bend and which can go into any part of the kidney. This is the access sheath which we pass into the ureter through this scope. You can see this is a very miniature, very small. This is a 5 or 6 French diameter. And through this, the laser fiber is 150 micron. That is passed through this flexible ureteroscope, and that can be used to trace any part of the kidney. And this is the advanced laser system, thulium fiber laser, TFL. Earlier it used to be holmium laser. For stones, the thulium fiber laser is the most powerful laser system which we have acquired in our setup. And here, as I told you earlier also in earlier diagram, your scope goes into any part of the kidney and you can lace any stone lying anywhere. This is the most difficult patient. This is the transplanted patient, kidney transplant patient, develop the kidney stones. Now reaching in the kidney which is transplanted, where all the anatomy has been disturbed, is a very, very difficult and Herculean task. Because the now ureteral anastomosis is anterior to the bladder. It is not a contemporary that you enter the bladder and you enter the ureteral orifice and can go up to the kidney, as I have shown you in earlier diagram. Here the orifice is anteriorly. To identify the orifice first is again very, very difficult task, then pass guide wire, then pass access sheath, and then your nephroscope and reach up to the transplanted kidney is very difficult. But we decided that we have to do the laser only because puncturing in this kidney is also very, very difficult. It is a very hard fibrotic kidney. So we pass the access sheath through bladder into the transplanted ureter, reach this stone and lace it like with thulium fiber laser. As I told you, this is the most powerful laser. You just touch the stone and stone will just become powder. And for the bigger stones, as I told you, the laser, there's a limitation for laser to break the bigger stones. But then the advancement has come, fans, flexible and navigable ureter access sheath, where we keep on lasing the stone, making it powder, fragmenting it and sucking it with the system so the bigger stones can be removed. And this is such a big stone which was removed with the latest technology, fans available in Ekai hospital. And again, the paper gave us a lot of coverage for this. The initial experience of about 300 patients of stone diseases revealed that we had more kidney stone patients than ureteral stone patients. And most of these patients, they were removed and patient was stone free without much complication rate in these patients. So this is the advantage of laser system because energy is more. Lasing time is less. Removing the kidney or ureteral stone from the patient takes just 10 to 15 minutes once you have reached the stones. This is such a powerful laser system. And then another application is in prostate. All of you know when the prostate enlarges, it causes either irritative symptoms, urgency, nocturia, frequency, or urge incontinence, or it causes obstructive symptoms like urinary hesitancy, intermittency, post-void dribbling, straining, not able to empty the bladder completely, and ultimately retention of the urine. So when there are too much bothersome systems or there is obstruction in the urinary flow, that more post-void residual urine and recurrent urinary tract infection, or there are back pressure changes like diverticular formation or hydronephrosis like this, or there is gross hematuria, then these kind of patients, they need surgical therapy. Before that, you can treat these patients with various medical therapies. All of you know your Dr. alpha blockers or 5-alpha reductase inhibitors. So that's not part of my talk, but you can treat them medically. Dr. Noria has been treating a lot of patients. I keep on seeing those patients. And then Once that stage is gone, as I told you, 5-6 indication, then there is a need for surgical therapy. And contemporary and the gold standard used to be transurethral resection of the prostate, TURP. Experienced person doing good TURP gives the best results. Though now the recent advancement in the form of laser enucleation of the prostate is just coming near to that, but still today also, if somebody asks you what is the best procedure, good TURP, whether unipolar or bipolar, done in good surgical hand, give you the best results in my experience. So this is a gold standard, where we remove the prostatic tissue with the help of unipolar cautery or bipolar. Bipolar gives the advantage that you can use the saline only and the patient doesn't get, fluid overload syndrome or something like that, which I have never seen in my life. We keep on reading in the books only. But then people say there can be bleeding in transurethral section of the prostate. The patient is taking some anticoagulant, so patient is comorbid. Then, the technology has come that we must use the lasers for these patients. This is the high-powered thulium fiber laser. It's not moving. थोड़ा स्लो, यहाँ तो डाउनलोड नहीं हुई. Not. वो तो डाउनलोड नहीं हुई. बैक जाइए. बस ये नहीं होता, मैं आगे नहीं हो रहा. Anyway, this is a laser enucleation of the prostate with the thulium fiber laser. And as you have seen, I don't know, this video is not playing over there. And you have seen once we are cutting the prostate, there is no bleeding. चला के देखने से मिला. So here again you keep on cutting and you enucleate the prostate as you were doing earlier in open prostatectomy. These all lobes, they will go back into the bladder. And then with the help of morcellator, you just morcellate and suck that whole of the prostate out, and the patient can be discharged the next day. Now a little bit it is showing. So this whole fossa will become wide fossa without any bleeders. So this is the morcellator. The video is not playing, but this is the morcellator. The whole lobes are, pushed back into the bladder, and then they are morcellated and sucked out, and, whole of the prostate is removed. But this was the only, video which was to be shown. Anyway, so the laser is now used for bladder cancer, for stones, as I have shown you, and then prostate. So these are the main indications for laser in urology. And of course, for prostate now, the recent advancement has come. If the patient is, having too many cardiac problems, Dr. Gill is not giving you the clearance. You can, just lift the prostate lobes like this. They're like stapling in devices available, and which is called a Urolift. And again, we are the first hospital to start this Urolift procedure in Punjab. And that gives good result. Patient belongs to Bathinda only, and he's sending me more patients. So this was again covered in, paper. And thank you so much.